Well, it's holidays.
It's still the Christmas season.
It
Looks
is.
kind of Valentine-y too.
We're good? All right. Good morning and Happy New Year. It's January 5th, 2021. We're going to call this Scott County Board of Commissioners meeting to order. Join me in the pledge. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you very much. Item number 2, a fun morning swearing-in ceremony. How do we want to do this? Do we want to do it up there with the microphone? Do we want to do it right here? We can turn a microphone. Let's turn it right here. We've got a couple judges that are gracious enough to come and swear us in, and I think Commissioner Barb Weckman-Brecky, you are going to go first.
I am, so I should go up front.
I think, and then we'll just try to keep some distance. We're all socially distanced. We masked in, we masked out.
All right, I have Mr. Jacob Brecky here to hold my Bible.
Where's Tracy? I want to make sure it works with the camera.
Let's see. I don't know.
You know what?
Okay.
Let me just, I want to make sure you guys, well, we should be, because Ron's on there.
Oh, in this,
I'll move out of the way.
go this way.
Just want to make sure you get that on.
We're in the center.
Yeah,
In
he's
the
hogging
center.
it. He's hogging the scene.
A photo bomber.
Over to the center here.
All right.
Okay. Then repeat after me.
All right.
I, Barb Wecky Breckman, do solemnly swear
I, Barb Weckman Brecky, do solemnly swear
that I will support the Constitution of the United States
that I will support the Constitution of the United States
and the Constitution of the State of Minnesota,
and the Constitution of the State of Minnesota,
and that I will faithfully execute and discharge
and that I will faithfully execute and discharge
the duties of the office of Scott County Commissioner, District 1,
the duties of the duties of the office of Scott County Commissioner, District 1,
in the County of Scott, Minnesota,
in the County of Scott, Minnesota,
according to the law
according to the law
and to the best of my ability and understanding.
and to the best of my ability and understanding.
Sign on the dotted line.
Thank you. Thank you for being here. Thank you for all you do.
I would have voted for you if I could.
All right, I think we're going to change the order a little bit. I'm going next because the Honorable Stacy is here to do this. Yeah, I gotta go.
Okay. Mr. Beard, repeat after me. I, Dave Beard, do solemnly swear
I, Dave Beard, do solemnly swear
that I will support the Constitution of the United States
that I will support the Constitution of the United States
and the Constitution of the State of Minnesota,
and the Constitution of the State of Minnesota,
and that I will faithfully execute and discharge
and I will faithfully execute and discharge
the duties of the office of Scott County Commissioner, District 4,
the duties of the office of Scott County Commissioner, District 4,
in the County of Scott, Minnesota,
in the County of Scott, Minnesota,
according to the law
according to the law
and to the best of my ability and understanding.
and to the best of my ability and understanding.
Congratulations.
Thank you. Thanks, son.
There goes. Good thing I had it turned off.
Thank you for coming to do this.
Oh, thanks for asking. It's an honor.
Commissioner Wolf.
I'm up. Absolutely, my pleasure.
Set. I, Tom Wolf,
I, Tom Wolf,
do solemnly swear
do solemnly swear
that I will support the Constitution that I will support the Constitution of the United States
of the United States
and the Constitution
and the Constitution
of the State of Minnesota,
of the State of Minnesota,
and that I will faithfully
and that I will faithfully
execute and discharge
execute and discharge
the duties of the office
the duties of the office
of Scott County Commissioner District 2
of Scott County Commissioner District 2
in the County of Scott,
in the County of Scott,
Minnesota,
Minnesota,
according to the law
according to the law,
and to the best of my ability
and to the best of my ability
and understanding.
and understanding.
Congratulations.
Thank you. Thank you again. My pleasure. Thank you for your work. Thank you. Thank you.
That's yours. Tom, that keeps that one then.
Yeah, don't lose them. Although we can come back, we can do it again.
We might have somebody come in and
Good way to start. Listen, it's been done before.
That's
right, I like you.
I will do so.
Thank you. Thank you, Roger.
Judges, thank you for coming and administering those oaths. We had to get you in here, without the Christmas party this year to get you in here.
Yeah.
One way or the other.
Missed the party this year.
We did too. All the parties are home.
That's true, that's true. All right, I think we're all back and we're still rolling, so we're gonna move to item number 3. There's not a motion to skip item number 3, is there? I'm kidding. Reorganization for 2021, this is where we go through the process every year of electing chair and vice chair. So first up, we will entertain nominations for chair, and I procedurally need to ask that 3 times, so.
Mr. Chair, I will nominate Commissioner John Ulrich of District 5.
Okay, so we have a motion, or a nomination rather. Are there any other nominations? Any other nominations? Any other nominations for chair for 2021? Otherwise, nominations are closed. So we have a nomination. Now I think we need to make a motion on that.
Motion to close nominations.
That nominations are closed. Do we need to vote on that? I think maybe we do.
Yes.
Procedurally, all right. We have a motion.
Second?
We have a second. Any discussion on closing nominations? Otherwise, as been the past history, JJ, you can roll call us out of nominations, please.
Commissioner Weckman-Brecky.
Aye.
Commissioner Wolf.
Aye.
Commissioner Beard.
Aye.
Commissioner Beer.
Aye.
Commissioner Ulrich.
Aye.
All right, so we have a nomination for chair of John Ulrich. We need to,
Okay, I make a motion that we accept the nomination.
there we
for
go.
Commissioner Ulrich.
I'll second that motion.
We have a motion and a second. Any discussion on John Ulrich being chair for 2021? Otherwise, JJ, you can roll call us through that process, please.
Commissioner Weckman-Brecky.
Aye.
Commissioner Wolf.
Aye.
Commissioner Beard.
Aye.
Commissioner Beer.
Aye.
Commissioner Ulrich.
Aye.
So is there, do I hand this gavel digitally? I don't know what camera's on. And then,
throw it at the
and then
camera.
John's gonna grab it somehow? I don't know how that.
All right, thank you.
He's got a Stanley
I
hammer.
got it. All right, well, we're on in a moment to nominations for vice chair, but before I do that, first of all, I'd like to say thank you for your election me as chair. It'd be an honor to serve the board and the staff and the county, so I'm thankful for that. And thankful for that opportunity. And but before we move on, I would like to comment on Mr. Beer's job. I was told I was supposed to roast him a little bit. I was supposed to roast him and give him some grief, but actually I won't be doing that. I just want to say, Commissioner Beer served with real distinction. I think his leadership was steady and consistent. He served with grace, kindness, humor, and humanity. I think he did a beautiful job as chair. It was a difficult decision to be a chair. Who would have known in March that most of our meetings would be remote? That we'd have hybrid meetings, and then most of our committee meetings remote. And been a difficult and challenging year, and Dave has done an excellent job. Want to thank him for that. There was one moment, though, that I reflect on, that I did think Dave's mic was broken, that his mic failed him. It's when we were voting on the levy. There was a long silence, a long pause, and I wasn't sure what was going on, but eventually there was a yes there from Dave, and he was able to vote yes for the levy because it matched up with growth within a tenth or some minuscule amount. His goal, his vision to have the levy be consistent with growth, that so no one would see a tax increase as a result of the levy. There may be some that are property valuation increase so that maybe their taxes went up, but a lot of people's will have gone down, and we stayed with growth, and so Dave led us through that process well. Those are my comments, and Dave's done a great job. Any other board members, if you'd like to make comments, do so now, but then Leslie's going to hand him a plaque with the gavel, and thank you for his leadership this past year.
Commissioner Ulrich, the plaque does read, "To Dave Beer, in appreciation for your outstanding service as Chair of the Scott County Board for 2020, presented by the Scott County Board of Commissioners, January 5th, 2021.
Thank you very much.
Congratulations.
Thank you. Thank you. Do we need a little, come on, Leslie, we need a little picture. We need a better picture. I gotta get this for. Thank you very much. Appreciate it.
Hey, Mr. Chairman, when you Photoshop my photo in there, would you be kind and pick a good one?
Absolutely. No, absolutely. And I just, I just want to say, you know, when this opportunity came up, I was a little reluctant. Not that I didn't want to do it. I just prayed through it and glad I did it. And who knew 2020 would be the year that it was.
Wow.
Who knew? So I just appreciate the chemistry here on this board. We have we don't always agree on things, but we always do it with grace. And so it was working with staff this year, kind of in the pressure cooker of life, was awesome to see things from the inside out a little bit more in depth. So thank you, everybody. It was a great honor, and I do definitely appreciate it.
Thank you.
Thank you. Yep.
Excellent service. Now we're moving on to nominations for vice chair, and I may have to ask for, are there any nominations more than 3 times here? I'm thinking, but I'm kidding. So are there any nominations for vice chair?
Mr. Chair, I'd like to nominate Commissioner Mike Beard for vice chair.
Okay,
I'll second.
Are there any other nominations?
Nope.
Are there any other nominations? Okay, I've fulfilled my duty of saying that 3 times, so we'll take a motion to close nominations.
Mr. Chair, I move that we close nominations.
Second.
Okay, we have a motion and a second. Any discussion? Otherwise, we'll have JJ take the roll.
Commissioner Weckman-Brecky,
Aye.
Commissioner Wolf,
Aye.
Commissioner Beard,
Aye.
Commissioner Beer,
I
Commissioner Ulrich.
Okay, now we'll take a motion to accept the nomination of Commissioner Beard for vice chair.
Mr. Chair, I move that we accept the nomination of Commissioner Michael Beard for vice chair and elect him as vice chair.
second.
Okay, any discussion? All right, JJ, take the roll, please.
Commissioner Weckman-Brecky,
Aye.
Commissioner Wolf,
Aye.
Commissioner Beard,
Aye.
Commissioner Beer,
I
Commissioner Ulrich.
Aye. So motion carries. We now have a chair and vice chair.
Mr. Chairman, I'd like to say thank you. I'll be there to back you up, and I'm sure we'll be doing this virtually, which is going to be way different than the last time, 4 years ago when we were chair and vice chair, but we'll muddle through somehow.
Right, right. And if I can't fulfill my duty a given week, you'll come back to Scott County? Is that the
Yep, I can jump on a plane and be right there, especially if good donuts are involved.
I can do that when it's 30 below. All right, well, we're on to item 4, which is amendments to the agenda. I don't believe we have any amendments to the agenda. So we'll move on to item 5, which is approve the minutes of our December 15th county board meeting. Do we have a motion to approve the minutes?
So moved.
Second.
We have a motion and a second. Do we have any discussion? All right, no discussion, so JJ take the roll.
Commissioner Wagner-Brecky,
Aye.
Commissioner Wolf,
Aye.
Commissioner Beard,
Aye.
Commissioner Beer,
Aye.
Commissioner Ulrich.
Aye. Okay, we're on to item 6, which is recognition of interested citizens. This is limited to items that are not on the agenda, and it's limited to 5 minutes or less, and anybody that wants to speak could approach the microphone. Is there anybody in the hall that wants to speak, or do we know anybody that is going to speak?
I don't see anybody here
Okay.
lurking.
Nobody.
Seeing none, we'll move on to the consent agenda. These are deemed as non-controversial and generally pass as one motion for all these consent agenda. 7.1 is to approve the lawful gambling on premises permit application for Shaco Valley Amateur Hockey in Louisville Township. 7.2 is to approve the tap room and brewer off-sale malt liquor license for Euphoric Brewing Inc., Blakely Township. 7.3 is to approve the request to amend the conditional use permit for Safety Science Inc. to allow leasing of space to other industrial tenants. Safety Science Inc. as applicant and 1120225 Street East LLC, property owner in Section 1 of New Market Township. 7.4 is approve the request for conditional use permit for Soda Electric to operate an electrical contracting business as a home business. Sean Cohn, applicant, and Sean and Christina Cohn, property owners in Section 30 of Belle Plaine Township. 7.5 is adopt resolution 2021-6, authorizing entering a grant contract with the Minnesota Department of Human Services to accept coronavirus relief funding for children's behavioral health providers and school-linked mental health services in the amount of $36,586. 7.6 is approve the renewal applications for 3.2 malt liquor licenses for Minnesota Harvest LLC and Suzette Inc. in St. Lawrence Township for 2021. 7.7 is approved processing of personal actions. 7.8 is approve the 2021 County Board meeting schedule. 7.9 is adopt resolution number 2021-1, adopting the Scott County Board of Commissioners operating rules and guidelines and rescinding resolution number 2020-02. 7.10 is to adopt resolution number 2021-2, appointing commissioners and other county officials to boards and committees for 2021. 7.11 is adopt resolution 2021-5, adopting a minor amendment to the Scott County 2040 Comprehensive Plan for Diamond W LLC. 7.2 is adopt resolution 2021-3, authorizing final payment to Pearson Brothers Inc. in the amount of $1,000 for the 2019 Seal Coat project. 7.13 is adopt resolution 2021-4, authorizing final payment to Traffic Marketing Services Inc. in the amount of $1,000 for the annual striping contract on various county highways. That's our consent agenda. Does anybody wish to pull an item for separate discussion? If not, do we have a motion to approve the consent agenda?
Mr. Chair, I will make a motion to approve those 13 items on consent.
Okay, we have
I'd be happy to second it, Mr. Chairman.
Okay, we have a motion and a second. Discussion? Okay, JJ, please take the roll.
Commissioner Wagner-Brecky,
Aye.
Commissioner Wolf,
Aye.
Commissioner Beard,
Aye.
Commissioner Beer,
Aye.
Commissioner Ulrich.
Aye. Motion carried. We're on to 8.1 is to receive a COVID-19 update. I believe Lisa Brodsky is going to give us that update.
Good morning, Commissioners.
Good morning.
Happy New Year. Just waiting for my PowerPoint. There we go.
Happy New Year.
Happy New Year to you.
Commissioner Ulrich and commissioners, I'm just going to mostly focus on vaccinations today, although I'll give you a little bit of an update of where Scott County is at as far as cases. Today, as of actually last night, we're looking at about, let's see, 11,318 positive cases in Scott County, which is about an increase of 377 from the previous week. We're still at a lower on the way down, which is nice. It's nice to not see 4-digit numbers these days. That number is actually a little bit higher than actual for the week because there was some corrections made to our database with some individuals on our east side of our county that were mislabeled as Dakota County when they were technically in our county. So we are still seeing a decline in number of cases, and we're really happy to see that. 2020 was, I heard earlier, a difficult year, and we are starting to see the light at the end of that tunnel for this year as we roll out our vaccination campaign. Next slide, please. So just a quick reminder, there are 2 types of vaccines available for the state of Minnesota. They have the Pfizer vaccine and the Moderna. Most of the Pfizer vaccine went to hospital-based care. For Scott County Local Public Health, we are focusing on just the Moderna vaccine. Both are very effective vaccines and both adhere to the safety standards and protocols that are required. For the Scott County vaccinations, for the Moderna, it's 2 doses. It's between 24 and 28 days apart. And we will be doing vaccines for people 18 and above. They are continuing to test it on lower ages, but right now it's only approved through the emergency use authorization for 18 and above. We are not requiring vaccines. The state of Minnesota is not requiring vaccines. It's strictly, they're not requiring them. It's strictly voluntary. Next slide. And another reminder for the public, we are getting a lot of phone calls on when vaccines will be available for them. The state of Minnesota is rolling out the vaccines based on a variety of factors, most of which that weigh quite heavily is the most at risk for a negative impact, serious illness, as well as those that have been disproportionately affected, as well as balancing equity and transparency. Next slide. It is a phased approach to vaccine. We are currently focusing on 1A, which is those healthcare workers, emergency medical services, et cetera. I have another slide that lays it out a little bit further. But right now, the state of Minnesota is very focused on 1A. We have not moved yet to the next phase and haven't received detailed guidance on the remaining phases, but this will be a phased approach. The community, when we get to open vaccinations for the entire community, that's like at the very end, and you see that in phase number 2. Next slide. So this is how it's being rolled out here in Scott County, and I hope that's big enough for you to read now. Phase 1A is on the far left column, and the general public you see at the very far right column at the bottom. So we have quite a few groups that we are targeting in between now and then, and balancing with our current availability of vaccine. So phase 1A, far left, is really those mission critical. So those that are responding to the current pandemic, hospitals, the vaccinators. Our vaccinators were done last week. Skilled nursing facilities where we're seeing a lot of cases, a lot of outbreaks, a lot of death among the seniors and at-risk individuals. Anybody who is working EMR, emergency medical responders, that includes like our local city police and fire. Clinics that are not part of a healthcare system, so Park Nicollet, Alina, those types of, that would be an affiliated clinic, so those the ones that fall in there are those that are not affiliated with those, so that don't have access elsewhere, are freestanding dialysis centers. We will be done with this group by the end of this week.
Good.
Wow.
And then we will start moving to group homes, long-term care, the adult foster care. So places that, congregate living facilities where people can't just get up and go to a clinic or go to, get out to get vaccine, or don't have access elsewhere. The individuals in these homes, for example, I think we have like 45 licensed group homes, multiple adult foster cares, home care agencies. This doesn't mean that local public health has to go to every single one of these locations to do vaccines. What we are currently working on is gathering lists of these individuals, making connections with them, and really identifying if they have access to vaccine elsewhere. All of our skilled nursing facilities are part of the, you'll see PPP in there. That's the pharmacy partnership program, where pharmacies have agreed to go to the skilled nursing facilities and help them do their vaccinations. Many of our assisted living facilities have also made connections with some pharmacies. We had about 4 that had not, and we reached out to a local or a regional pharmacy who agreed to do their vaccinations for them. And so out of all the assisted living facilities, local public health will really be only going out to about 5 to assist them with their vaccinations. So it is time consuming, but it's really about creating those partnerships in the community, and local public health's role is to fill in that gap where they aren't, if they're not currently covered. So next week, we'll be starting to roll out those congregant living facility locations. So it's going to be a while before we get there. Assisted or essential workers would be in the next phase. That's a huge group of people. That includes teachers and childcare staff. Just teachers and school personnel alone is about it's over 3,000 people in Scott County. So we'll be rolling out, working with the schools to figure out the best way to deliver those vaccines. So as you can see, there's a variety of different groups. It's going to be very time consuming, and we also have to balance that with the amount of vaccine that we have. Next slide. So our current status, our current allocation is 300 vaccines per week. We've received 2 allocations of this so far, so we only have 600 vaccinations to date. We are hoping that increases soon, because it will take us quite a long time just to even do the teachers if we're only getting 300 vaccines per week. I mentioned already the skilled nursing, they're covered. We did our community vaccinators last week. We did 21 vaccinations. We had 0 report of any serious adverse reaction for any of them. Sore arm, which is typical. That was heard for most of my staff and myself. It was quite sore, just for a couple of days, but no fever, no reaction whatsoever. So that was really positive. So we will be doing this week. We have 3 clinics set up, one in the south in Belle Plaine, one in Prior Lake, and one in Shakopee. And this is going to cover our emergency medical services. So the city, police, and fire, our unaffiliated clinics have been invited to that, on our dialysis center located down in Belle Plaine, I believe it is, has also been invited. And for those that are unable to come this week, we have put aside another day next week just to ensure that we want to get our folks covered, and they'll come to us on that case. We decided to go out to 3 different locations, doing a push strategy, because if we only did Shakopee, it's quite time consuming for a police officer from Elko Newmarket to drive all the way to Shakopee to get his vaccinations, and we really want to keep these folks in the field. Next slide. So currently, I think I mentioned this already, we're just really working through 1A. Because we're only getting vaccines at 300 doses per week, we thankfully, actually, I mean, it's both some positive and negative, but it's helping us spend time working with these locations and trying to figure out where they can access vaccines, and identify really who just really doesn't have that capacity elsewhere. And the focus right now, EMS, I mean, we're really almost done that group. So our direction from MDH is when we have finished 1A1, we're okay to move forward to 1A2 and 1A3 and just really get them done. I think we're pretty fortunate in our county that we have such good partnerships, and we may end up moving a little bit faster through these groups than a larger community or those that just don't have access. So we will be moving to 1A2 by next week.
Lisa, just a question here, if I might. Is there any kind of reallocation procedure? Let's say you don't have enough, but some other organization has too much vaccine. In other words, is there a way to redistribute to those that don't have enough?
There is a redistribution process that's also part of our partnerships for those, and it's if we had too much, and I don't think we won't get to that point in the near future, Commissioner Ulrich. But one of the things that we have access to, for example, our unaffiliated clinic, we could allocate if they wanted to do their own vaccines. They can't order because right now the vaccine is only available in lots of 100, and our unaffiliated clinic only needed like 15. So they would not be receiving a lot of 100 for their 15 individuals. So if they weren't coming to us, they were provided an option of us reallocating 15 of our doses, which when I say our doses, it's really Scott County doses. So we could reallocate 15 of the vaccine that we have to them to enable them to vaccinate themselves. As far as reallocating among other counties, that's not yet available. I do recall, though, during H1N1, there was a lot of sharing of vaccines, particularly between the hospitals and local public health. It was just the way the vaccine rolled out and current needs. So there was a lot of back and forth at that time. The benefit of the Moderna vaccine is it's a lot easier to transport than the Pfizer, because the Pfizer had to be kept at -75, and the Moderna vaccine is we can keep that in standard coolers. So when we get to that point, if we need to, we will be able to. Next slide. So we'll just continue working with our target populations as vaccine becomes available, and we will work our way through 1A. We cannot move forward to 1B until MDH does give us the go-ahead. But right now we are just working down that chart that you saw until we finish them all and get to 1B. I apologize for that. It really is it's just going to be a matter of time and patience. Right now, again, we don't know when they're going to start increasing our allocation. But when we get the vaccine, we'll be giving out the vaccine. So we are planning this week for next week and for the week after. We will, once we get to the larger groups, we'll be doing, when we get to the community vaccination groups, we'll be doing a larger type of full-scale planning where we would have a lot of support and hopefully running, maybe 300-400 people at a time through our vaccination clinics. Right now, these are very small, or most of them are small targeted vaccination clinics. Next slide. I think that was it. Commissioners, is there any other questions that I can answer for you today?
Mr. Chair, I got a question here for Lisa. How are we doing with people taking the vaccine in our own county? I mean, staff-wise, and also all of the businesses and hospitals and folks. Are they readily accepting it? I've heard in some counties in California, like many of them, less than 50%. What are you seeing out in the field?
Commissioner Beer, it's a little early to answer that question as far as what the vaccines that we're doing. I can tell you that we have a lot of people signed up for the clinic this week. In one jurisdiction, I think 25 out of the 40 that qualified for the vaccine signed up. And in some cases, for the 15 that didn't, it was not because they were anti-vaccination, but most of them were either they had access elsewhere or they were just on leave that week. We do have a few that aren't going to get the shot. But as we move forward, I can provide that data. I do know, I saw a statistic yesterday. I think we have about 1,200 people in the county that have already received the vaccination, and that's probably those that are, they're hospital-based and healthcare-based. We have had a lot of emails and communication from there's we haven't gotten to those levels yet, but even in those, like in 1A, 1C, 1B, a lot of emails about people wanting the vaccination and wanting to know, are anxious for us to get to their priority levels so they can get the vaccination. I would guess we're gonna get, if I had a crystal ball, I would say about 50 to 60% will eventually be interested in getting the vaccination. And we can provide that information as we go along.
Yeah, it's just more of a curiosity, and then a follow-up question, if I may. And I have not really done a ton of research on this, but what do you have to say to folks that may or may not, now I'm not talking about political reasons, but I know there's folks that are anti-vax. I try to research that when we gave our kids those vaccines, which we did, not this one, but haven't had the chance. Some of the things, like here's a question for you. I know you have a son, I believe, but I have a daughter who is 17. Would you have her take the vaccine?
I would recommend the vaccine for anybody that would be at risk. We know science indicates we need about a 70% immunity rate to reach that herd immunity, which will be important to get over this. So right now, though, a 17-year-old is not approved for the vaccine that we get, but she could get the Pfizer. For my own children, even the ones that have already had COVID, I have recommended to them that they should get the vaccine as soon as it's available. So it is recommended for those, even though if they've tested positive.
Interesting.
Mr. Chairman?
Yes.
Thank you, Mr. Chairman. Lisa, first of all, I had two things to say, but you've talked about herd immunity, and I just, tongue-in-cheek, I got to tell you, I used that phrase the other day, and somebody said, call it community immunity. But it might have been the setting I was in where herd might have been taken a little more literally. Okay, tongue out of cheek. Let me just say two serious things. First of all, a question you may not be able to answer now, but I'd be curious is to know about the community effectiveness of the vaccines. We see a positivity rate of X, whatever it is. Will we be testing people that have had the vaccine just to be sure that it's working, that they're not continuing to test positive, or do you anticipate we'll see a drop in the infection rate, those so-called cases that we hear about? That's my first question. If you can't answer it now and we need to wait a couple weeks, I'm happy to do that. But know that inquiring minds think about that. And then I have just a comment. Sometimes over the years, you and I have differed over the mission of public health and what we're doing and why we're doing it and so on. But from this commissioner's perspective, what you're doing right now in planning for and dispersing the vaccines and making sure that the most vulnerable are reached and the most necessary citizens are vaccinated first, to my way of thinking, that is your sweet spot. You're doing exactly what this commissioner thinks is the #1 primo reason for public health exists. So I just want to commend you on the report and on obviously the thoughtful planning that's gone into the rollout as the vaccines have become available. And just kudos. I want to offer a commendation to you for doing that. Thank you.
Thank you, Commissioner Beard. And it looks like with the palm tree in the background, you are somewhere warm. So I commend you for being able to escape our frozen tundra here.
Well, go ahead. We've escaped a couple things. One is it's Florida, And the state is wide open. Nothing is shut down. Everybody's asked to wear a mask in the distance, but the level of public angst and intensity is much less down here than it is up there. But that's a political comment. I probably shouldn't even make it. But yes, it is slightly warmer, and I'm grateful for that.
To answer your first question, Commissioner Beard, as far as community effectiveness, I mean, we know the vaccine from scientific evidence is 95% effective. It's been very well tested. I mean, especially with our skilled nursing facilities, we have had so many outbreaks and so many deaths in our skilled nursing facilities, and which drives up our numbers. And intuitively, as we get immunity for those community immunity in the skilled nursing facilities, we should start seeing less cases in that population. And that's another reason why they were, put up right near the front. We've had a lot of cases, and in Scott County as well, of healthcare workers that have contacted COVID. So. Intuitively, we should start seeing less cases, and we already are seeing less cases now. I suspect it's due to some of the restrictions in the new emergency or in the executive order, really focusing and targeting on places that were driving up our numbers where there was a lot of community spread. So I'm very, very hopeful. And we do know, schools are back in session around January 18th, so we have a little window here to try and get as many people vaccinated as possible between that. So logically speaking, I mean, we did see this during H1N1 as well. As vaccination became available, we had less cases.
Good. Thank you. Thanks, Lisa.
Thank you.
Any other questions? Well, Lisa, thank you for all your work. I know Commissioner Beard already thanked you, but I want to thank you as well. I know that this whole time period has got to have been an exhausting time period for you and your staff, and long hours and working around the clock and high alert. And so thank you for all that you're doing and will do. We really appreciate it.
Thank you, Commissioner Ulrich. I have to just want to commend my staff who've been really working tirelessly. Getting the job done. It does take a full team, and I have great staff. We've had some really good support from the EOC, the Emergency Operations Center, and this really couldn't have been done without the support of the county and the staff and the community as well. We really see just so many positive stories and strengths in our community that will have a lot of stories in the future. So thank you, everybody. Be well, stay safe.
Thank you.
You too. Thank you.
Take care.
All right, we're on to item 8.1, which is not 8.1, we're on to item 9, which is committee reports and commissioner updates. We'll start with Commissioner Brecky.
Thank you, Mr. Chair. Our last board meeting was December 15th. The afternoon of that day, December 15th, I participated in the NACO, the National Association of Counties Central Region Conference call, mostly an update on COVID response, the vaccine, those types of issues that all the counties in the country are dealing with. On December 16th, I participated in the Human Services Industry Council meeting for the Shakopee High School Academies. They're still trying to really involve businesses and Scott County and the city of Shakopee in the education of the high school students. One of the things they have upcoming here in January and February is a virtual job fair where folks from all kinds of different professions are doing videos, and the students will be able to view those videos and then ask questions. So I think our local schools are doing the best they can in this virtual environment to continue connecting high school students, especially with real life and job opportunities. On December 17th, we had our meeting with our legislative delegation to talk about our priorities for this year's session. Right after that, on December 17th, we had 2 ditch board meetings for our joint ditches with LeSueur County. Doing some redetermination of benefits on those ditches. So appointed the viewers who will go and start collecting that information and making those cost estimates for all of our property owners along those ditches and in that watershed, actually. On December 21st, I participated in the first meeting of Minnesota Human Services Redesign Committee. It's a committee pulled together by AMC and MICA and MAXA to really try and do some brainstorming about how we as counties can influence the Department of Human Services for some real transformational change. We think it's really good time in that we've had to have a lot of changes this year with waivers and the way we administer programs, and trying to keep that momentum going and really look thoughtfully and strategically about, are there some things the counties shouldn't even be doing that really the state's mandated to be done, the state should be taken care of. Really looking at seeing if we can drive some change there that will hopefully, keep or improve services and save money. So we'll let you know where that's going. I think we're just at the beginning of that work. This isn't really a county assignment, but on December 22nd, I delivered gift bags to senior citizens in Scott County. It's one of CAP's new programs this year. I thought it very interesting and good for senior citizens who are involved with CAP's programs like the SHORE program or energy assistance or other programs where they're involved with CAP. They did a holiday or Christmas delivery to each of those folks of donated items, very useful items like cleaning supplies and toilet paper, and then some gift items. So it was good to get out around the county and deliver some of those gift bags to some of our senior citizens and disabled citizens who've really been isolated this year, and it was good, and I really applaud CAP for starting that program. That's the end of my meetings. Otherwise, spring must be, I know winter's just started, but spring's in the air, because I have spent the last 2 weeks talking a lot about ditches and ditch cleanup and dust coating on gravel roads. So I think people are ready for spring, thinking about what's going to happen in the next couple months, and I guess I applaud these citizens who are bringing these issues up, because we're being proactive and hopefully going to get things in good shape for spring. So that's the end of my report.
Thank you. Commissioner Wolf.
Thank you, Mr. Chair, and we have a lot of winter left. I think we're going to get cold. Taking a guess.
Go green.
Oh, I gotta go green. Kind of. Okay, thank you for that. So on the 16th, the Metropolitan Mosquito Control District, we had our truth in taxation that night. Went pretty quickly. On the 17th, our legislative delegation, as Commissioner Brecky had mentioned. Also, the Scott Louis Sewer Ditch meetings. I gotta admit, I didn't like those at first, but I don't mind them now. There's, I don't, and I think we're solving some problems and trying to help some people out there. So, Elko Market had their final meeting of the year. Everything quiet there. Spring Lake Township had a meeting also that night, and it was basically about limiting boat slips on their lake. There's a number of people that are. They have a place, and then they're renting out, a slip or 2 or 3 for $3,000 or $5,000 a piece, and pretty soon the lake is full of people that don't, live there or whatever. So on the 18th, I actually was out at St. Pat's Bar and Grill out in Cedar Lake Township. They opened up. I met Senator Eric Pratt out there. That business and a lot of business restaurants, I talked to the owner, and he had $3,000 a month in insurance. They just bought the place a few years ago. They had to put a new septic system in. They remodeled the place. And so, the few bucks they're getting from the CARES or any of this COVID relief, it's not cutting it. And they're cutting through a lot of savings and stuff. Fast forward to Saturday night. I went over to Mystic Lake because that's the only place really open for a place to eat. I met some friends. The place was packed. I couldn't even find a parking spot. So it's just funny. And it was only probably 7-8 miles from as the crow flies away from this St. Patrick's that was shut down again. So, and fined. So unfortunately, but somehow or another we got to open up. That's give you a political comment. But anyhow, then on the, sorry. But on the last night, the 4th, Prior Lake had their city council workshop and a regular meeting. They had 3 swearing-ins there. They had the mayor, Kurt Briggs, and Kevin Burkhart. They were all sworn in last night. They talked a little bit about the vaping stuff, so they're going to have a public hearing coming up on that. And then Cedar Lake Township had their monthly meeting, and things are going pretty good there. We talked about putting a couple lights in and stuff. They had a couple requests of me that they want to help out with. So and then there's just not a meeting, but getting a lot of questions on the broadband, and so we're going to try to get our Perry Mulcron is going to try to come to some of the town board meetings where there's whatever limited access, and kind of maybe give a little report update on what's going on. They're going to hire 3 people to get people installed and get hooked up, and I think everything's ready to go. They just have to get hooked up, and it'll take a little bit of time, like any cable company there. So. But it's moving along good, and I think it's going to be a great thing for the county. So that's my report, Mr. Chair. Thank you.
Thank you. Commissioner Beard.
Good morning, everyone. Let's see, since the last meeting, I'm scrolling through my little iPhone here to try to find stuff. Let's see, the 17th, or no, the 16th, as Commissioner Wolf mentioned, we had our annual truth and taxation and set the budget for the mosquito control district. I think it was a very brief meeting, Commissioner Wolf, because we're spending exactly as much as we spent last year with those trying to suppress the pesky mosquito population. And so there was no tax increase at the mosquito control district this year. Then the next morning, of course, participated in the legislative priorities with our legislative delegation and Claire. I miss Claire already. I'm sure she's enjoying being a grandma and being retired, and we'll do everything we can to help Perry as he takes over the legislative duties for the county. I attended a portion of the ditch commission meeting that I'm a part of, that I'm supposed to sit on, due to some technical difficulties, jumping around from Zoom to WebEx, just a technical request to staff is that often as we can make it work with Zoom works pretty easily. WebEx, there was a little machinations there, and I think I eventually ended up calling in. But was glad to do my duty on the ditch commission, and I think Commissioner Wolf, Commissioner Brecky are outstanding partners on those boards. On the 22nd, chair vice chair meeting via Zoom. Excuse me. Enjoyed a quiet Christmas down here in sunny Florida. On the 29th, CAP Finance Committee meeting. There's some important things going on at the CAP agency right now. You know that they're in the old Workforce Center building that the county is disposing of its portion of the ownership, and CAP has to move. So there's some things that I'm not at liberty to divulge all of it, but a building has come available close by that I think will serve them very well. In fact, as we're having our meeting here this morning, the executive director and the legal team are actually negotiating the purchase of a building to replace their workforce center. And I just want to commend Leslie, commend the county staff for how well you're working with the team over there at CAP agency. I know they're like an extension of our HHS department. They do the Lord's work with the thrift store, the food shelves, and then actually putting people who find themselves temporarily homeless, actually putting heads on pillows. They're doing good work, particularly since that new CFO has taken over. The budget is in the best shape I've seen it in what's been 5 or 6 years since I've been on that board. They're just doing good work, and I think they're in a great position to make a move from that building on County Road 83. And to my colleagues on the county board, staff is working with them to help make it financially possible in a way that protects the taxpayers of the county, but still preserves the CAP agency's community service. More about that when I have liberty to talk about what's happening. Let's see, that was the 29th, was it? Yeah, the 29th. And between then and now, I guess there's been nothing else until this morning. Mr. Chairman, that's my report, other than just, if I can just follow on Commissioner Wolf's comments on the differences in the approaches to the pandemic. I'm in a state now that has taken a more hands-off approach in trusting localities and businesses in particular. The businesses down here are driving a lot of the requests for masks and social distancing and limiting people in their stores where they see fit. And I think the numbers of infections, hospitalizations, the rate of morbidity and things like that are equal to or better than several of the states that have actually gone to much more draconian shutdown measures. And again, when this is all over here in another year or so, I hope that people can actually parse the data, the inputs, the results, and maybe we can learn from this about how much effect and what effect government should have as we play this role in looking out for the health of the public and the citizens. Two drastically different states and results and inputs. And as importantly, the mood of the citizens on the street and in the stores and in the restaurants is way different. A lot more cheery and upbeat, less stressful. People just seem to be more content and less stressed, where I find myself right now as I sit here this morning, as opposed to what I left just a few weeks ago in my home state of Minnesota. So just some observations.
Okay, does that mean you're inviting us down to join you? Do you have a lot of cities coming out of the city, or what?
Yeah, the next chair, vice chair meeting, we should just have it right here.
All right, well, we'll move on. Commissioner Beer.
Thank you very much, Mr. Chair. As was mentioned on the 17th, the legislative priorities taking place at the old breakfast. The one thing I just wanted to point out on that, it just seems to me, and maybe there was a time when this did happen. I know we all have our one-offs with our local delegation and beyond, but if, especially as Perry at some point steps into this, that we have almost like a workshop setting, and you know me, I need another meeting like I need a hole in the head, but it just seems like there's a disconnect. So if we're putting our priorities forward, that there's folks that are willing to carry that water, I just think a little bit of groupthink in the sense, and that can be dangerous too, but as opposed to just our one-offs, that we get together and look each other face to face and say, hey, is this really a priority that can win the day, and is this something you're willing to carry, or otherwise let's move on. And then the only other official meeting was last night at Prior Lake Council, where I will say that Councilor Braid also got sworn in.
Oh, I thought I had mentioned that.
So they had three returning, and we're all sworn in, and also their city manager went through the review process, and they kept him around. I say that tongue in cheek, he's a good guy. And that will conclude my report. Thank you.
Thank you. Well, I'll make a brief report here now. On the 16th, I had the Transportation Advisory Board, and you never know if you're really going to get the money until the final vote on the regional solicitation, and we did get the $7 million for the Jordan project. That was the final yes, so that's a sure thing. A lot of people, it was their last meeting, like a Randy Malishnik from Carver will no longer be on the tab, and others such like that either didn't run again or didn't get reelected. So it was kind of a sad goodbye kind of meeting a little bit. Lisa Freeze also was her last meeting as the TAC chair. She had a 3-year term as TAC chair. That's a tremendous amount of work. She had major presentations at every tab meeting, and I just can't imagine how much work that involves. And I can't recall a TAC chair ever doing better than Lisa did, or I think Lisa stood out head and shoulders above TAC chairs that I can recall. I think she did a fantastic job. John Solberg will be the new TAC chair, so as we move forward. On the 16th, the Minnesota Valley Transit Authority Board met. Really was about budgets and projects upcoming in the next year. The 17th, the legislative priorities has already been mentioned. The 22nd, the chair, vice chair, and on the 4th, the STA Legislative Committee met. The STA is feeling a lot of pressure from Met Council and Metro Transit. They seem to be kind of almost flexing their muscles against the suburban transit providers, and there was a new contract related to equipment, and there were changes, and they were really given the directive, sign it in 2 weeks, otherwise you're going to lose your funding. And so it's a little troubling. that if there's pressure on transit because of the virus and lower ridership, that it does seem like it's causing some dynamics of one authority, transit authority, asserting themselves over another in ways that I think are not helpful. That's the end of my report. We're going to move on to the county administrator update.
Thank you, Mr. Chair. First off, I want to thank you for recognizing public health. During the holidays, Lisa and her staff were responding on holidays, off hours, coordinating with other folks in the county, just watching the emails and questions that we were getting. And they really have been putting in a lot of time and hours to coordinate and plan for this. So that recognition was well deserved, as well as the coordinating with our staff now and our employee relations department for how we'll roll out vaccines here within the county. You've heard about the deputies, fire, police, but the jail and other folks that eventually have to be coordinated and how that will roll out. So she's had a lot of time and been working hard on that. So well-deserved recognition. The other big thing that's been going on has been the focus on the rollout of the state's business program, and back and forth and what's required and not required. We went live yesterday morning with that. Our portal was open. By the end of the day yesterday, we had 230 smaller businesses apply and 100 landlords apply within that program. Actually, if they were all eligible for the maximum amount, it's pretty much would cap off our program. Now, not all of them will be or asking for that amount, so people should continue to apply. But you could see the need out there, and the applications are coming in, and people were ready to apply yesterday morning. We did have folks in Belle Plaine. Jake opened the libraries early for folks that didn't have computer access or scanning access, and some things were set up to make sure we supported those businesses as well who had requested that. So again, we're partnering with the CAP and the CDA on that, and so want to thank them for being partners in that program as well. We are, Commissioner Beard mentioned the CAP agency, and I think that's going well. We are continuing to have discussions also with the school district and new options on the workforce center building and how we move that forward. So those are continuing to happen as well. And that's just a final reminder that we will be closed on January 18th in honor of Martin Luther King Day here at the county. The board meets the next day, so that is our only closure between now and the next board meeting. That's the end of my report.
Thank you. Item 11 would be a recess for attorney-client meeting.
Mr. Chair, we do not need to recess.
Thank you. Item 12 is a motion to adjourn. Do we have a motion?
So moved.
Second.
We have a motion and a second. Any discussion? JJ, if you call the roll.
Commissioner Wickman-Brekke?
Aye.
Commissioner Wolf?
Aye.
Commissioner Beard?
Aye.
Commissioner Beer?
Aye.
Commissioner Ulrich?
Aye. We're adjourned. Thank you. Have a good day.